5:30 starts now.
Thanks for joining us at 5:30. I'm Mike Ben David. A popular Burlington event canceled because of Triple E. Today, the Intervale Center said on social media that its Somerville event scheduled to take place today and next Thursday are canceled to keep Vermonters safe from Triple E. It comes as health officials recommend limiting time outdoors during the evening to avoid the potentially deadly mosquito-borne virus. Our John McMahon spoke with the health department on how to stay safe.
The threat of mosquitoes carrying Eastern equine encephalitis, better known as Triple E, continues to spread throughout New England following the death of one person in New Hampshire. Vermont's agencies of health and agriculture want to remind people to be vigilant. Patsy Kelso is the Vermont State epidemiologist and joins us now. Patsy, thank you for being here.
You're welcome.
Just jumping right into it, your recent warning identifies high-risk towns, including Alburgh, Burlington, Colchester, and Swanton. Why are these towns at higher risk?
We have a state arbovirus response plan on our website, and it specifies the criteria for what categorizes a town as low, moderate, or high risk. High risk means that there's either been a human case or sustained activity in mosquitoes where we're trapping mosquitoes and finding positives from 1 week to the next.
And where else is this a concern? Like, kind of speaking more generally, and is it only between dusk and dawn?
Well, mosquitoes are unfortunately active throughout the day, but they're most active between dusk and dawn, so around 6 p.m. to 6 a.m. And we're urging Vermonters, if they are in a high-risk town, to avoid being outside if possible during those evening and early morning hours. If you do need to be outside, or if you're outside at other times of the day when mosquitoes are active, take precautions like using insect repellent.
And if you're bit by a mosquito, what are the symptoms to watch out for that might be Triple E, and how do they differ from something like West Nile virus?
The symptoms are hard to tell apart. It might be a very mild illness or even no symptoms, but some people will develop a systemic illness with symptoms like fever and chills, headache, body aches. And in less than 5% of those people, central nervous system involvement can develop, which means significant headaches, high fever, seizures, other severe illness symptoms that would warrant medical attention. And the disease is fatal about 30% of the time when people have those significant symptoms.
And you're keeping these recommendations in place until the first hard frost. Are we at risk once again when the weather thaws?
Once we have a hard frost, the mosquitoes are really done with their activity for this season. So once there's been a hard frost in your area, we consider that to really dramatically decrease the risk.
Hopefully everyone's taking the proper precautions. Patsy Kelso, thank you for joining us.
Thank you.